Welcome to Retina Consultants of Texas. My name is Dr. Nguyen. I'm one of the physicians on the team and just want to welcome you to our practice. You're here to see a retina doctor. That may sound very intimidating, but I want to reassure you that it's in no ways scary. You're going to have the best experience with all of our staff, and we're all a part of the team, and we're here to help you. First, if they were to come in, they're greeted by our front desk, and they do the check-in process. They do meet our technicians. So there they get their vision checked. So typically that happens to be with an eye chart. We also do their eye pressures. So after your eyes are adequately numb, you really won't feel the sensation. It comes close to the eye, and so it just makes a couple of clicks, and then we get a couple of numbers, a couple of readings for the pressure, and that's about it. The eye pressure, it's just a gauge for us to know, are your eyes in good shape? Is the pressure in normal limits? And also, is it safe to dilate your eyes? If it's too high, we typically say, we may hold off on the dilation. So it's also a safety check. Following that, they get their eyes dilated, because in order to know what we're treating, we have to look inside the eye. And that's where we have ability to see into the retina, which is the film in the back of the eye. There's just a couple of drops that are following the numbing drops, and that's going to take probably 15-20 minutes to adequately dilate the eyes, which is why there's a dark room that patients wait in. I would say the drops last for about 4 to 5 hours when they're put into the eyes, and so patients will notice the effect for that long. And so typically they'll need dark sunglasses to protect from the bright lights, because much more light is coming in. If it's your first time, I would say probably have someone come with you in case you're not able to drive or arrange transportation. But usually patients afterwards are able to drive on their own. As far as doing up close work, that is kind of a limitation for some patients who have their eyes dilated and need to say work on the computer or read a book or something. That may be a little bit impaired for a few hours, but typically it goes back to normal once your eyes are undilated. Typically we do a couple of photos to start. One is called OCT, optical coherence tomography, just a fancy name for essentially a camera that's able to take a picture of the retina. Another one is we call the Optos camera. That camera gives us a picture of exactly what the retina looks like, as if we were looking into it too. And so with that, we can kind of get a bigger picture of exactly what's going on. In terms of what you experience as a patient is typically just sitting in front of a camera and having pictures taken, just like pictures taken anywhere else, but you're kind of closer into the light. On the top of my head, I have a checklist that I ask. So what medical conditions do you have? What medications do you take for these conditions? Have you ever had any eye surgery before, any lasers, or any trauma that you've experienced for your eye? Are there any medications that you use, such as eye drops or even natural artificial tears for the eyes? And how are these monitored or managed? And I think also on top of that is family history is important too, especially when we're diagnosing. It seems like a battery of tests. Why is this necessary? Shouldn't I see the doctor first before they decide what to do? And is it really going to help me? Like, what is it all for? And so I think just having the perspective that actually all of this information is going to be used in order to help you, and also as a baseline too, when you come back, it's going to be used to compare, and in addition to that, communicate with other doctors. So your experience at the doctor's office is actually from the moment you step into the door. All the information that we gather, all the history, all the medications is vital to us helping you. And so I think if you think of it as the entire experience in order to help us get more information and help you, that may help, in terms of understanding what's going on. Once you see us, the experience is such that we just want to find out more about you and find out how we can help you, and that we're on the same team. We want this to be the best experience that you have, and our mission is to preserve your vision.